So everybody, I am here in the city of Carson. Once again, I was invited to be a part of the City of Carson Women's Health Conference. Health is so important. And right across the hall was my goddaughter Toy's dentist. This is Dr. Tamara Dixon, and I was so glad to meet her because this is a topic that a lot of us are weary about, anxious about. We procrastinate. We don't want to go to the dentist. And so, Dr. Tamara, I am so excited to hear about your insights that our audience needs to learn about how deadly it can be when we do not take care of our teeth.
That's correct. Ms. Jewel, thank you so much for interviewing me today. My mission is to get the message out to the public about how deadly bacteria in your mouth can be to the rest of your body. Because the bacteria in your mouth is found in different diseases such as heart attacks, strokes, diabetes, Alzheimer's, rheumatoid arthritis, pancreatic cancer, respiratory disease. So a lot of oral bacteria travels through the body, and if you don't take care of it early enough, then you can have the symptoms and possibly death.
And I'm thinking when you said Alzheimer's, so that could be the root of someone that has Alzheimer's, the fact that they neglected their teeth?
The research studies have shown that 85% of Alzheimer brains that they tested had oral bacteria in them. Mm-hmm. It's a spiral key they find in the mouth that travels through the nervous system to the brain and is connected to dementia and Alzheimer's disease.
And so what I understand you do is you take saliva tests.
Right.
And that determines what dental treatment your patients need.
Right. So if I see a patient that has some inflammation, I will do a saliva test and figure out what bacteria they have that's causing the infections. Because when you have bleeding gums, it's not normal. So nothing's supposed to bleed when you wash it. So when you wash your hands, they don't bleed.
Come on.
They're not supposed. If your hands bled every time you wash them, you would run to the doctor.
So our gums are not supposed to bleed.
The gums are not supposed to
bleed.
bleed.
Now I was sharing with you that I use charcoal, but you said charcoal is for the whitening.
Right.
But I also use hydrogen peroxide, and I also use apple cider vinegar, and I use clove.
I love those. I
use clove, and I use Himalayan salt. What are your thoughts about that?
I think that the salt and the peroxide work excellent for inflammation.
Okay.
And so they do help get the inflammation out, but you still have to get the offending bacteria out from underneath the gum. It's what you can't see that can kill you.
I know.
Everybody likes to have the beautiful smile,
yes,
but it's what's underneath that smile that can kill you.
Where's the location of your dental office?
I'm located in Inglewood off of Prairie on Eric Street, 645 Eric Street, right next door to Global Cardio Care.
Okay, I've been there many times.
Yeah, so people know what that is, then that's where I am.
Well, Dr. Tamara, as you saw today, many of the women here today are mature women, some are retired, senior citizens. It was a mix, but I would say the majority are women that are retired. And what I understand is that when we cross over to that age, that's when we're more vulnerable to problems with our dental care, and that's when we also have a decline in our health insurance. And so how can you speak to that about insurance issues, and how can we take care of our dental care when our finances are diminishing?
Right. I find that people who retire and they get into the Medicare system, they don't have an oral component with it. So if your job doesn't extend that coverage, and some jobs end that coverage at 65. So when your Medicare kicks in, you lose your dental coverage. Mm-hmm. And so sometimes Medicare will have an option for dental coverage, but it doesn't cover you for what you need. And so they don't pay for what you need to have done, basically.
What type of financial plans do you have for your patients?
In my office, for those particular patients, I do have a in-house dental discount plan.
In-house dental plan.
And
okay.
so that plan will cover everything you need at half off most services. So that people can afford it. And even when they have dental coverage, usually the dental coverage may be 50% anyway. So they're still paying half. So you're paying your coverage premium plus you're paying half, plus that half expires after like $1,000.
Okay.
So dental coverage has not increased in 40 years. It's always been $1,000 to $1,500 coverage. But the dental procedures have went up. 40 years ago, you could get everything done for $1,500. Now, one tooth, and your benefit is gone, and you have to pay the 100% out of your pocket.
You know, I'm just sitting here thinking, one of the reasons I was excited to interview you, because you're female, Okay, you're African American, you're in the dental care, and my sister is videotaping this, and our uncle was a dentist in Tulsa, Oklahoma. So he was the one that told us about brushing with hydrogen peroxide and baking soda. But I want to speak, could you share maybe a scenario of one of your clients? I don't need the name, but is there a particular scenario that would really speak to this issue of why it's so critical to get our care? I think you said once a year or twice a year?
It would be twice a year minimum.
Okay.
Twice
What
a
have
year
you
minimum.
seen? What were some of the scenarios that really?
Well, I've seen people, I have a lot of them, but I can do one that a man came into me for treatment, and he was a great patient. He had had a little heart incident, and you know, those are preventable. Heart attack, stroke, diabetes, complications, they're all preventable. And so he had gum disease, and we started treating him with it's a tray system called Perio Protect. So I did his deep cleaning, treated him with the Perio trays, and I kept begging him to bring his wife. So every time he come, I said, "Where's your wife? You know she needs to come."
Okay.
She was beautiful. She had all the cosmetic work. She'll come in for that, but she would not come in for her regular routine cleanings. So then I left to go do research with the CDC, which I did for 2 years, and then I came back, and she was sick. So she ended up passing away like a few months later. And then I asked his daughter, like, what did she pass of? And it was pancreatic cancer. And that's the cancer that's related to gum disease.
Isn't that something?
And I know she had it. And I would always tease him, like, you're going to be a widower. You better tell your wife to come. He's like, oh, I tell her all the time. We would just tease all the time. And
So
he's a widower now.
the key word is preventable. This is what we need to hear,
It's
preventable.
preventable.
So, but
A lot of
those that are
disease.
watching, just like myself and my sister who's videotaping it, what would you say to those of us that have this anxiety, this fear? It's like, I don't want to go to the dentist. I know I'm
Yeah.
procrastinating. And then we take all these temporary Band-Aid treatments to numb the pain, but we know this little
Right.
tape in our head. I know I need to go to the dentist. I know I need to go to the dentist, and we keep putting it off. Sound the alarm. Tell us why it's so critical.
Well, one thing is that fear is real.
Yes.
So it's not nothing's wrong with you because you're afraid
Thank
to
you.
go to the dentist.
Thank you.
So you can forgive yourself for that. Because at the University of Washington, where I did a summer research training program, they have a fear department, and they have the most psychologists in any of the schools besides School of Psychology in the
Wow.
School of Dentistry. So they have a whole fear clinic.
Fear
They
clinic.
have a fear clinic.
And so how do you address that fear?
So what I do is I try to, first of all, you have to talk to the patients, because a lot of times they don't understand, and a lot of the fears are old fears. And we have a lot of new procedures that we do. I have an anesthetic mouth rinse. So you come in and you just rinse with this anesthetic, and your mouth is numb, and I can work on you without a needle. So there's a lot of different new technology
Yes.
and new things that we have
Yes.
that you just have
We're not
put up a
aware of.
block. Right.
I mean, that happened to me. I had a very traumatic dental visit. It was worse than childbirth.
Oh no.
In my mind.
Oh, yes.
I mean, I was
In your
sliding
mind,
underneath the
right.
chair.
Right, in
And I
your
was like,
mind.
I'm not going. And then I finally, went, and I realized technology had advanced, and I was amazed
Right.
at the technology. And when she said, it's out, I was like, it's out? I mean, I was so surprised.
Right. That's
But
what
what I'm
happens all
being
the time.
inspired by you is not to wait until I need a tooth pull. I need to be more consistent
Right.
with my dental care.
Right.
I had no idea. I mean, I would hear that, if you don't take it for your dental care, you could die. But to hear all the different diseases that could be preventable, Alzheimer's, diabetes,
Yes.
all related to lack
Right.
of dental care?
And diabetes is a major one. They're bi-directional. So the
Wow.
diabetes triggers the gum disease can trigger the diabetes. When you clean the teeth and get rid of the bleeding and infection, the diabetic marker goes down on its own, no medication.
What about headaches and obesity? Anything else?
I'm not so good with the headaches and
Okay.
obesity. The headaches usually that's a jaw joint problem.
Oh,
So
a
it's
jaw
like
joint.
Yes, it's called TMJ.
How long have you been in the dental profession?
I've had a private office since 1994.
Since 1994.
1994.
What do you love most about what you do?
I love dentistry. I mean, I love it, and it was God chose it for me.
Wow.
Like you think you're gonna know what you want to do. I was a biomedical engineering major when I went to college, and so I wanted to do like bionic parts. I wanted to make arms and legs, knees. I wanted to do all that.
Yes.
And then I took an introduction to dentistry class, and I loved it. And I said, I'm gonna do this. I didn't even think twice. So I feel like it chose me. And then now my calling and all my research is telling me I need to educate our community about.
I'm so glad that you came to
systemic
this
connection.
conference. I feel like we got a private session with you. And, you know, those of you that are watching, don't you want to go to someone who is excited about what they do, that loves what they do, and knows that it's a calling? There will be a different chair-side manner with a dentist who's really passionate about what they
Yes.
do. And so I'm so grateful that you took the time to talk with me, Dr. Tamara Dixon
Thank
of
you so
Inglewood,
much.
California.
Thank
You're my
you
new
so
friend.
much. Thank you so much.
You are my new friend. And I'm inspired
Thank
because
you
I
so
want to live a
much.
long time for my grandbaby.
Yes, and
So-
you guys come in and do
so-
that saliva test. Even
Yes.
if you're afraid, just do the test,
Do
and
the
then you'll
saliva
see
test.
if your gums are affecting your
And how
health.
much is that?
It's $125, and that's what the company charged me, and that's what I charge the patient.
Do we get the results the same day?
You get the results like within a week, but I also give you a report. I will take the bacteria that comes up on your test and do research on them and tell you what other diseases that bacteria is found in. And you'll be so surprised. You'll be
Okay.
so surprised.
It's
You'll
kind of
say,
scary because when okay, I'm scared to see the results. What are you going to tell me to get me ready?
Well, usually
That
I'll
fear.
tell you, it's not as bad as most people think. So usually I will say, this is what we need to do. It's a solution.
Okay.
It's a solution to it.
I know we were closing earlier, but this is one thing I want to say. Can you speak to the one? See, I know for me, I felt ashamed. I neglected my teeth. And when I finally went to the dentist, I was like, I didn't want to open up my mouth. Like, really, you're a motivational speaker.
But you're at the dentist.
And you neglected your teeth because you're scared. I felt really ashamed. So what would you say to someone who's like, I'm ashamed of how I neglected my teeth?
But it's okay because that's what we're here for. We're dental professionals and we see
So there's
everything.
no judgment.
It's no judgment.
That's what we
see
wanna hear.
everything and
No.
we want to make you better.
That's what I want to hear.
Yes.
No judgment.
Yes.
No judgment. Okay. So thank you for watching. And if you're in the area, look up Dr. Tamara Dixon in Inglewood, California, and we'll make sure we post your contact information at the bottom of the screen.
Thank you so
Thank
much.
you so much.
Thank you.
Thank you,
Thank you,
family, for
sister.
watching. This is my new sister friend.
Thank you.